Hello, I'd like to talk today about sports concussions and student athletes, specifically in the state of North Carolina. My name is Carissa LeClaire. I'm a family nurse practitioner that currently works at Raleigh Neurology. I'm also a certified neuroscience registered nurse and a student at Duke University in the Doctor of Nursing Practice program. According to the CDC, a concussion is a brain injury. All concussions are serious. Concussions can occur without loss of consciousness. Concussions can occur in any sport. Recognition and proper management of concussions when they first occur can help prevent further injuries. Early recognition can even prevent death. Let's talk about two deaths that did occur in North Carolina related to concussions. Matthew Gfeller, 15, suffered an intracranial bleeding after a helmet-to-helmet collision. Then 4 weeks later, Gfeller-Waller died from a second impact syndrome. This is swelling of the brain caused when a person who has suffered a concussion receives another blow to the head before the prior injury has had time to heal. What came of these deaths? The Gfeller-Waller Concussion Awareness Act. It became effective 2011-2012 school year. There are laws in many states. You need to be aware of the laws here in North Carolina to protect your student athletes. You may recognize this bill sitting on Capitol Hill that became a law. Let's take a look now at what the Gfeller-Waller Concussion Awareness Act actually includes. Written information detailing the recognition of the signs and symptoms of concussions and other head injuries should be provided. All coaches, school nurses, athletic directors, first responders, volunteers, students participate in interscholastic athletic activities, and the parents of those students shall receive on an annual basis a concussion and head injury information sheet. The sheet must be signed and returned to the coach in order for students to participate in athletic activities. If you are not receiving this information, you need to contact your school and find out why. A description of the physiologic and the potential short-term and long-term effects of a concussion and other head injuries should be provided in the information that you're given. If a student participating in an interscholastic athletic activity exhibits signs or symptoms consistent with concussion, the student shall be removed from the activity at that time and not allowed to return. A student should not be allowed to return until cleared by a licensed provider. Each school shall develop a venue-specific emergency action plan to deal with serious injuries and acute medical conditions in which the condition of the patient may deteriorate rapidly. Each school must have documentation that all of these requirements are met. Please make sure that your school has these requirements documented. The CDC has developed Heads Up Concussion and Youth Sports Initiative to offer information about concussions on their website. Additionally, you can find information on baseline concussion testing. Before impact testing was available, a student's post-concussion testing was compared against a database of students of similar age from throughout the nation to determine what should be normal. But impact is a revolution in treating concussions because it allows doctors and parents to compare a youth's cognitive ability against him or herself rather than a national database to determine the extent of both injury to the brain and recovery. Comparing post-injury test results to baseline test results can assist healthcare professionals in identifying the effects of injury and making more informed return to school and play decisions. Repeat concussions before allowing the brain time to heal can increase the chances for long-term problems, resulting in brain swelling, permanent damage, or it can even be fatal. If you think your athlete has a concussion, take him or her out of play and seek the advice of a healthcare professional. that has experience in evaluating concussions.